the past few days, we interviewed different persons. Now let's hear about what are their personal opinions about sexual self. What is your idea when you hear the word sex?
Ayun, yung unang tanong, most of us pag narinig yung word na yun ay syempre medyo sensitive dahil ang bansang Pilipinas ay hindi po ganong liberated tulad ng ibang bansa. Masyadong close-minded yung mga tao tungkol dun sa topic na yun. So, minsan pag syempre ako, including me also, pag naririnig ko yun, medyo sensitive din ako since hindi nga siya masyadong pinag-uusapan dito sa Pilipinas. And pag nabanggit mo siya is, ang tingin agad sa'yo is yung bastos, ganun. Yun. It's what I think about when I hear the word sex.
Sa akin, ang idea ko dyan, siguro pwede nating gawing bad o good sa situation na gano'n. Pero sa akin kasi parang ang sex kasi normal sa isang tao. Depende na lang sa pagkakaintindi ng mga bagay-bagay. At ang sa tingin ko, ang sex kung naririnig ko para sa nagmamahalan. Yun lang yung para sa tingin ko.
Either gender or yung reproduction ng nating mga tao or ng mga hayop.
Ang idea pumapasok sa akin kapag nakakarinig ako ng word na sex ay yung pagtatalik ng mag-asawa. Na usually talaga, para lang talaga sa mag-asawa. And then,
What are the effects of sex, good and bad?
Para sa akin, kunyari ako babae, may mens ako, syempre may cramps na nagaganap. So, pwedeng ma-minimize yung pain kapag ginagawa yun. Tapos yung hindi naman mabuti ay yung parang, kasi may mga taong hindi maingat, kaya pwedeng mag-cause ito ng pregnancy. Lalo na kapag bata ka pa, yung wala ka pa sa tamang edad.
Siguro sa madudulot nito, sa mabuti at hindi, siguro mabuti to dun sa mag-asawa. At ito ay hindi rin dapat dun sa hindi dapat na pag hindi pa kasal. Siguro dapat muna silang ikasal bago maranasan ganong yung magandang dulot.
Dulot ng sex, yung isang magandang dulot is nakakapag-produce nga tayo. At yung hindi naman is dahil nga dito, madaming maagang nabubuntis na kabataan. At dahil nga din doon, masyado ng madami nang nagkakaanak, sobrang dami na yung anak nila. And which is hindi naman kayang buhayin. At yung isa pa is nagsisex. Kani-kanina na nakikipag-sex, hindi natin alam, may sakit na pala, di ba? Di tayo din nakahawaan.
ang mabuting dulot kasi nito ay yung self-satisfaction. And ang masamang dulot nito ay yung pagkakaroon ng sakit tulad ng HIV. Walang control o walang tamang ginagamit pero nakikipag-sex ka sa iba. Then yung pagkakaroon din na conflict sa inyong mag-asawa. Lalong hindi magandang dulot yun na biglang alam mo na sarili mong may asawa ka. And then makikipag-sex ka sa iba.
How important it is to know about our sexual self?
Importante siya kasi lalo na po sa sitwasyon ngayon, ang mga kabataan medyo mapupusok po, ayun. Tapos po dapat talaga knowledgeable yung mga kabataan about doon para hindi ganong padalos-dalos yung iba, yung alam nila yung gagawin. Yun, yung at least man lang responsable sila pag ginawa nila yon, ganun po. Alam nila kung ano yung consequences, yung ayun, dapat may alam ka talaga tungkol sa sarili mo.
Napaka-importante nito dahil sa sex, marami itong pwedeng idulot. Nandyan nga yung masamang dulot. So kung kung wala tayong tamang kaalaman kung paano to gawin, maaaring makasira to sa mga pangarap natin. Tulad ng ibang mga kabataan na maagang nabubuntis na hindi na plano. So makakasira to sa kanyang mga pangarap. At nandun din yung sakit na nga nasabi ko tulad ng mga AIDS. Maaari mo rin ikamatay to kung wala kang kaalaman.
Sa aking palagay, mahalaga ang magkaroon tayo ng kaalaman dito sa sexual self na to ay alam mo yung limitasyon sa pakikipag-sex. Natututunan mo yung tamang paggamit o pag-control dito.
What can you advise to the younger generation to avoid this situation?
Since mga bata pa kayo, dapat hindi nyo muna iniisip yung mga ganitong bagay. Dapat ang iniisip nyo muna sarili nyo tapos yung pag-aaral nyo. Doon muna kayo mag-focus kaysa dun sa ginagawang pang-adult stuff.
Mag-aral muna kayo kasi bawal pa.
So, our topic for today is about sexual self. So, pag nakakarinig kayo ng sexual self, ano ba yung unang-unang pumapasok sa isip nyo? So, okay, sexual self has four minor topics. One of the minor topic of sexual self is the development of secondary sexual characteristics. But before we proceed to the development of secondary sexual characteristics, let's first define what is sexual self. Sexual self is a part of yourself where you learn and understand your sexual development and how people's sexual activity, beliefs, misconceptions, and unlimited access from the internet on sex can influence your own sexual behaviors and responses. So, development of secondary sexual characteristics. It appears during puberty, humans, and sexual maturity in other animals. Distinguished from the primary sex characteristics, the sex organs, which are directly for sexual reproduction. So, primary sex characteristics, it is our sex characteristics to distinguish boys or girls. So, nung mga baby pa tayo, alam na ng mga magulang natin, di ba, na tayo ay babae or tayo ay lalaki because of our sex organs. So, yung sex organs natin, ito yung tinatawag na primary sex characteristics. So, ano ba yung secondary sexual characteristics? So, sinasabi secondary sexual characteristics appears during puberty. So, what is puberty? A stage of development characterized by reaching sexual maturity and the ability to reproduce. Physical changes, which mark the transition from childhood to young adulthood. The onset of adolescence coincides with the advent of puberty, meaning when puberty starts, no matter how young you are now and adolescent. So puberty pala is the process of physical changes through which a child's body matures into an adult body capable of sexual reproduction. So what age does puberty start? There is no set time when puberty begins. Rather, a period of time over which it may start. For girls, puberty can start between the ages of 8 and 13, usually at around 10 or 11 years. The first changes begin. However, it can begin earlier or later than this. For boys, puberty can begin between 10 to 15, usually at around 11 or 12 years. However, like girls, puberty can begin earlier or later than this. So wala siyang schedule, walang nakakaalam kung kailan talaga siya, walang exact date or exact time kung kailan talaga darating at kailan mag-e-end yung puberty. So ano ba yung mga mga signs of puberty? Sa girls, the first sign of puberty in girls is the breast development. So, di ba, nung mga 10 years old tayo, 11 years old, bumubukol yung breast natin at yung masakit masagi. So, sa babae, yun yung first sign of puberty. Sa boys, I know, the major sign pala sa girls ay the menstruation. So pag nag-mens na ang girls, yun na yung major sign na nasa puberty stage na siya. Sa boys, the sign for boys is the so-called ejaculation. Ano ba yung ejaculation? So ejaculation is the process of releasing semen or sperm. So boys, if capable na kayong makapag-release ng semen, you are in the stage of puberty. The girls naman, pag nagme-mens na, you are in the stage of puberty. Sa ngayon, isa sa issue ng kabataan ay ang sexual issue. At tumataas ang bilang ng teenage pregnancy because at the age of 14 to 17, kahit minor pa, capable na ang boys makabuntis. At ang girls, as long as you are nagme-mens na, pwede na mabuntis. According to World Health Statistics, 49 women out of 1,000 ay kasama sa teenage pregnancy. So ibig sabihin nasa ano ba 'yun? Nasa 4.9% yung nanganganak every year na kasama sa teenage pregnancy. So as this lesson continue, malalaman natin yung importance na may knowledge ka about your sexual self entirely. When does puberty end? The average age for girls to be fully developed is 17. Boys usually are fully grown by 19 years of age. Though boys and girls are physically able to have babies, they are not sexually mature until around 2 or 3 years after reaching adult height. But in 21st century, sinasabi ng pag-aaral na ang female daw ay nag-i-start ng 15 years old. Ang male, nag-i-start ng 16 years old. Due numbers of factors. Una, yung trabaho. Kasi ngayon, dati kasi in 21st century, more on labor tayo, mano-mano yung trabaho at mabibigat. So ngayon, because of high technology, lahat ng trabaho ay napapagaan at napapadali. Pangalawa, food intake. Ngayon may mga nakakain tayo na hindi natin alam na yun yung nagiging dahilan na tayo ay mas maagang nahihinog, mas maaga tayong nagdadalaga at nagbibinata. So yun yung mga factors kung bakit in 21st century mas matagal ang puberty stage compare sa ngayon. So primary and secondary sex characteristics. Their development is triggered by sex hormones. So ano ba yung mga sex hormones natin? First, sinasabi din na sex hormones levels arise as puberty begins. So ano-ano ba yung mga sex hormones natin? Una, estrogen. Pangalawa, progesterone. Pangatlo ay testosterone. This estrogen and progesterone is produced more on girls than boys. Ito naman si testosterone is produced more on male than female. So si estrogen plays a role in the development of female secondary sex characteristics. So sinasabi na sex hormone levels arise as puberty begins. Ibig sabihin, at this puberty age, tumataas si estrogen level natin. At ang epekto ng pagtaas ng estrogen level natin ay ang pagdi-develop ng breast, lumalaki yung balakang, wider hips, pubic hair, and armpit hair. So yun yung magiging resulta na at puberty age, tumataas si estrogen level. Si progesterone as counterbalance of estrogen. So pag tumaas si estrogen, bumababa naman, nagdi-decrease si progesterone. Ano ang mga nagiging epekto pag nagdi-decrease si progesterone during puberty stage? First symptom ay nagiging anxiety, depression, irritability, sugar craving, weight gain, mood swing, insomnia. So yun yung mga nagiging symptoms pag bumababa si progesterone during puberty stage. So, ang role pala ni progesterone ay nakakaapekto sa ating behavior. Kaya minsan, di ba, pag nagdadalaga tayo, o di kaya nagme-mens na tayo, minsan depressed tayo, nagiging irritable, gusto nating kumain ng mga chocolate, matatamis, di ba? Minsan nagkakaroon tayo ng dysmenorrhea. So yun yung mga naging dahilan na pagbaba ni progesterone, yung mga symptoms na yon. Sa si testosterone naman ay napoproduce siya more on male kaysa sa female. At si testosterone ang nag-i-stimulate ng development of male secondary sexual characteristics. So siya din yung itong testosterone hormone, siya din yung nagiging dahilan kung bakit may mga nagbabago doon, may mga nagiging physical changes din sa lalaki. So, itong mga 6 hormones natin, guys, ito yung nagiging dahilan at this age, 14 to 17 or even 18, agresibo tayo. Okay? Ito yung nagiging dahilan na nagiging agresibo tayo sa mga bagay-bagay, lalong-lalo na related sa sex. But, etong mga sex hormone ay hindi lang siya nakakaapekto, hindi lang siya booster ng katawan, nagiging booster din siya ng utak, ng brain natin, ng blood cells, ng heart. Nagiging booster din siya. Kaya at this age, wag na kayong magtaka na agresibo kayong sumubok ng mga bagay, agresibo kayong sumubok ng mga bago. Because of our sex hormones na pag nagdadalaga na tayo at nagbibinata, tumataas din yung level nila. Primary and secondary sex characteristics. Primary sex characteristics, ito yung, yan na, sex organs natin sa babae, ovaries, vagina, uterus, and fallopian tubes, and penis, testis, prostate gland, and seminal glands in men. Secondary sexual characteristics. Okay, so ito na yung breast development natin, deepening voice, body odor, and the appearance of facial and ito yung mga magiging physical changes natin, girls. Richer voice, di ba? Nagbabago yung boses natin, minsan nagiging buo o nagiging malakas. Hair growth, sex desire, o ito yung sinasabi ko na during puberty stage, nagiging agresibo tayo. Okay? Hindi lang naman ito sa babae, pati na rin sa lalaki. Broader pelvic bone, breast development, ovulation, menstruation, sex organs develop, acne, ito yung sa facial natin. Minsan kasi 'di ba, pag nagdadalaga tayo, bigla-bigla tayong nagkakatigyawat. 'Di ba, may mga tumutubong mga hindi ka nais-nais sa mga mukha natin, and then nagiging oily yung mukha natin. May mga changes, hindi lang din ito sa babae kundi pati na din sa lalaki. Increased perspiration, nagiging pawisin tayo. 'Di ba? May mga times na nagiging pawisin ka na konting init lang nagpapawis ka na. Emotional. So ito yung epekto na bumababa si progesterone kaya naaapektuhan yung behavior natin. Ito, sa male, skin gets oiler. So same lang din sa babae ng skin nagiging oiler din. Facial hair, yun nagkakaroon sila ng bigote, balbas. Shoulder gets wider. Ayan, nag-uumpisa ng magiging macho. Hair under the arms, pubic hairs. Ito, penis get longer and wider and testes get larger. Oh my God. Primary and secondary sex characteristics. So ito yung kaibahan at similarities nila. Secondary sex characteristics, body and facial hair, more muscle and mass, greater height than females, broadening shoulders, ayan. Similarities nila, pubic hair, oily skin, ayan. Same lang. Voice deepens, acne, ayan. Increase in height, same lang. Increase in body odor, di ba? Pag parang nagbibinata at nagkakaano na tayo, hindi naman natin ginusto, pero nagkakaroon tayo ng amoy. Yun, nagiging isa siya sa nagiging changes sa babae at lalaki. Ayan, secondary sex characteristics of female, hips widen, ayan. Nagkakaroon na tayo ng curves, lumalaki na yung balakang natin, mas nagiging sexy na yung babae. Development of breast, distribution of fat to hips, body gets curver, ayan. So the next slide will be tackled by Dowilin, the diversity of sexual behavior.
So hello everyone. Today I'm going to discuss to you the diversity of social behavior. To start with, let me discuss to you first what is gender. Gender or kasarian means it is a socially constructed characteristic of being male and female. When we say male, tumutukoy po ito sa kasariang panlalaki. Male has its own sexual organ. Same as for the female, the kasariang pambabae also has its own female sexual organ. Another meaning of gender. Gender is that it is a social understanding on how sex should be experienced and how sex manifests in behavior, personality preferences, capabilities, and etc. Ang sex po ay base sa eksperyensya at kung paano po ang sex ay may papakita sa pamamagitan ng kilos o galaw o ang personalidad ng isang tao. A person with male sex organ is expected to embody a masculine gender. Also same with the female, must possess a feminine nature. Gender is historical. It is produced by media or a popular culture. It is taught by families, schools, and etc. It is reinforced through songs, sayings, language, fashion, and many other forms. Gender is a system of classification that values male-gendered things more than female-related things. Gender, it also refers to society's division of humanity into distinctive categories based on sex, and also serves as a guide on how males and females think and act about themselves. Ibig sabihin po ito po ay pagtukoy o isang gabay kung paano ang isang lalaki o babae ay mag-isip o umaksyon ng nararapat sa kaniyang sarili, kung paano makisama sa iba, maging sa kilos o gawa. Ang male gender po ay tinuturing ding iba, lalo't higit sa mga occupational job. Dito naman po natin makikita yung gender equality. Ngayon po, halos pantay-pantay na ang katayuan ng babae at lalaki sa lipunan. For example na lang po, dati po meron po tayong presidenteng lalaki. Sa ngayon po, meron na rin tayong presidenteng babae. Noon, meron tayong driver. Para lang yun sa mga lalaki. Pero ngayon, meron na rin mga babae. Dati, may piloto. Ngayon, meron na rin babae. Mayroon lang pong mga bagay na hindi pwedeng gawin ng lalaki at yun po ang pagbubuntis at pagkakameron ng menstruation sa female gender. Gender representation. Ito po ay maaaring panlabas na anyo ng tao sa pamamagitan ng pag-uugali, pananamit, pagbibihis o pagsasalita. Gender roles, ito po ay kakayahan ng bawat isang lalaki o babae kung paanong magsalita, manamit, mag-ayos ng sarili at yung ugali na nababase sa asal na pagkilos na naayon sa nakatalagang kasarian. So, meron po akong tanong sa inyo. Are you proud of your present gender today? Why or why not? To further understand this topic, may papalabas po kaming video.
In recent years, healthcare centers have started understanding the importance of incorporating sexual orientation and gender identity, or SOGI, in their medical records. Traditionally, one's assigned sex at birth is their biological sex, which depends on their sex chromosomes. If they have a Y chromosome, their biological sex is male. If they have two X chromosomes, their biological sex is female. However, things aren't that simple. For example, a person could have a Y chromosome, but they're missing specific genes that encode for specific male characteristics, so even though they're chromosomally male, they appear as what is stereotypically described as female. So you're thinking biological sex can be linked back to genes, right? Well, things get even more complicated than that. Some genes get expressed at high levels and others at low levels. So a person may have genes that express a high level of testosterone and little or no estrogen or progesterone, or vice versa. Finally, hormones like testosterone, estrogen, and progesterone bind to receptors, and some people may have lots of receptors that can easily bind to hormones, whereas others may have very few receptors. In many cases, these people are intersex individuals whose bodies do not fit into the standard definition of male or female. The bottom line is that biology is messy, and like most things, biological sex exists on a spectrum. Now, separate from the biological construct of sex is gender identity and gender expression. Gender identity is a person's own sense of their gender, and gender expression is how they present themselves to the world. Many people identify as either man or woman, but there are also various types of non-binary gender, or gender identities that lie outside of the man-woman dichotomy. For example, someone could identify with multiple genders, such as Native or Indigenous Two-Spirits do. Furthermore, some will identify with a gender that's neither man nor woman, while others may have a more fluid gender identity. Some individuals identify themselves as transgender, when their gender identity is discordant from the sex assigned at birth. Meanwhile, there are people who don't feel any of these labels describe them or don't like the idea of identifying with a specific gender at all. Neither biological sex nor gender identity determines a person's sexual orientation. This concerns what gender or genders an individual is sexually and/or romantically attracted to. An individual can be heterosexual, which means they're attracted to a different gender, or they're attracted to the same gender, and the preferred term is gay, not homosexual. An individual can also be bisexual, meaning attracted to two or more genders, or pansexual, meaning that they are attracted to any gender. Some people identify as asexual, where they may not experience sexual attraction to anyone. Finally, terminology continues to change and evolve, and the words that people use to describe their sexual orientation is ever-changing and evolving as well. Now, depending on their gender identity, any person can choose the pronouns that suit them the best. Commonly used pronouns include he, him, his, or she, her, hers. Often a person can choose the pronouns they, them, theirs, which are more gender neutral, and you can use these pronouns when talking about someone whose gender you don't know. For instance, you might say, "This patient's name is Sam. They have diabetes and they're here for a follow-up on their new medication." Not only is this considered grammatically correct, but pronouns like they have been used to refer to singular personal pronouns for hundreds of years, even by esteemed authors like Shakespeare and Jane Austen. When someone changes their gender expression, they may choose to go by a new first name, and might even regard their previous first name as a dead name. All right, now, many individuals have to face a daily struggle of being referred to by the wrong pronoun. This is known as being misgendered. Imagine the following scenario. A transgender young woman named Esther is in a waiting room, and a clinician yells across the room, "Mr. Albert Kim, please follow me." Being referred to by the wrong gender or dead name or both can cause a deep sense of shame, loss of self-esteem, and leads to harassment and discrimination from others, even from healthcare staff. This is especially true if that information is declared publicly. That young woman might not want to come back to the clinic and might even feel unsafe now that others are aware that she's transgender. In fact, based on the 2011 National Transgender Discrimination Survey, 28% of transgender patients postponed medical care due to discrimination. 19% are refused medical care altogether, and 28% experience verbal harassment by medical professionals. That's why in a healthcare setting, it's essential to collect SOGI data, or a patient's assigned sex at birth, gender identity, and their pronouns without making assumptions based on their name, appearance, or behavior. Also make sure that these are documented in the Electronic Health Record, or EHR, for other healthcare workers. Now, gathering SOGI data and referring to a person as they wish can take an additional 30 seconds or so, but this is time well spent. Simply saying, "I want to address you the way you want to be addressed. Can you tell me your name and pronouns?" can make them and their families feel more comfortable and trust that they're getting the best care possible. It's important to note that SOGI information can change over time, so it shouldn't be considered fixed. If you accidentally refer to a patient using the wrong pronoun or their dead name, it's important to apologize, correct the mistake, and go on using the right pronoun and their chosen name. Okay, now in a healthcare setting, sometimes administrators ask for a patient's assigned sex at birth for insurance or billing purposes, and that is often confirmed with an identity document such as a driver's license. Administrators can also ask for their gender identity and pronouns. However, sexual orientation is considered private or sensitive information and can only be asked by the clinician responsible for the patient and only if it's relevant to the patient's care. All right, as a quick recap, healthcare systems collect and report sexual orientation and gender identity data, or SOGI data, from their patients. Sexual orientation refers to whom you are sexually and/or romantically attracted, while gender identity is about how you identify yourself, and sex is about biology. It's also important to ask someone which pronouns to use when referring to them. Collecting this data is essential to show respect to patients and their families, but also to understand the differences individuals with a particular sex and gender identity can have.
Diversity of sexual behavior. Gender identity is defined as a personal conception of oneself as male or female, or rarely both, neither. Ibig sabihin po nito na sa gender identity, simula nang tayo isilang, meron tayong dalawang kasarian na matatawag at ayun po ay ang kasariang pambabae at ang panlalaki. Next is sexual orientation. Is a term used to describe your pattern of emotional, romantic, or sexual attraction. Sexual orientation may include attraction to the same gender, also known as homosexuality, a gender different than your own, heterosexuality, both men and women, bisexuality, all genders, also known as pansexuality, or neither asexuality. Ibig sabihin po nito, dito po natin mababase sa gender orientation, yung pagkakaiba kung paano natin ma-label yung kasarian na nais natin base sa ating emosyon na nararamdaman natin. Yun lang po. And next, heterosexual, also known as straight. It describes a person who is attracted only or almost only to the other gender. Ibig sabihin po nito, ito po yung mga taong nagkakanasang sexual sa miyembro ng kabilang kasarian. Mga lalaki na ang gustong makatalik ay babae, at sa mga babae gusto naman po ay ang lalaki. Next is homosexual. Maika-classified po natin ito sa tatlo. Maaaring gay, lesbian, or queer. Describes a person attracted only or almost only to those of the same gender. Ibig sabihin po, ito po yung mga taong attracted sa kaparehan nilang kasarian. Kagaya po ng gay. Ang gay, attracted sila sa kapwa nila lalaki. Sa lesbian naman po, attracted sila sa kapwa nila babae. And when we say queer, dito po natin masasabi yung tao na medyo nalilito pa rin po sa kung ano nga ba talagang kasarian niya. Next is bisexual. It describes a person attracted to both men and women, though not necessarily equal or at the same time. Ibig sabihin po nito, so ano nga ba ang ibig sabihin ng bisexual or bi? Ibig sabihin ng dalawang ito, may tutukoy natin ito sa dalawa, sexual or sex, ay kasarian. Sa Tagalog ay silahis na ang kahulugan ay pwede sa lalaki o babae. Hindi lang sa lalaki at babae, dahil kung lalaki lang talaga ang gusto mo, bakla ka na talaga at hindi na bi. Maraming nagsasabi ngayon na bi daw sila, pero di naman sila nagkakagusto sa babae at nandidiri daw sila kapag ito ay nakakasama. Other term of bisexual, ito po yung mga taong nakakaramdam ng attraction sa dalawang kasarian. Ito din po ay isang estado ng pagkagusto ng individual sa kapwa niya lalaki o babae. Kadalasan din itong tinatawag bilang pansexuality, yung kanina ko lang pong nabanggit, o nagkakagusto sa kahit anong uri ng gender or sex. Next is pansexual or omnisexual. Describes a person attracted to those of any gender. Ang pansexual naman po, ito po yung attracted sa kahit na anong kasarian. Next is asexual. Describes a person not sexually attracted to any gender. This is different from deciding not to have sex with anyone, abstinence or celibacy. Ibig sabihin naman po, ito po yung mga taong walang nararamdamang atraksyon na sexual sa anumang kasarian. Maidagdag ko lang po, ang iba pang uri ng mga kasarian na matatawag ay yung common na rin po ngayon, transgender. Transgender, ito naman po yung mga tao na nakakaramdam na siya ay nabubuhay sa maling katawan. Ang kanyang pag-iisip at ang pangangatawan ay hindi magkatugma. Siya ay maaaring may transgender na katauhan. Sexually transmitted disease is to be discussed by Miss Monique Bicomo.
Hello everyone, ang i-discuss ko ngayon ay tungkol sa STD or Sexually Transmitted Disease. Sexually transmitted disease or STDs are infections that commonly transmitted by having sex with someone who has the infection. The causes of STDs are bacteria, parasite, and viruses. Spirochetes. Most STDs affect both men and women, but in many cases the health problems they cause can be more severe for women. If a pregnant woman has an STD, it can cause serious health problems for her baby. If STDs caused by bacteria or parasites, then it can treat with antibiotics or other medicines. If STD caused by a virus, then there is no cure. Hindi lang sa sex nakukuha ang sakit na ito. Depende ito sa specific STD infection. Pwede rin ito makuha through sharing needles or breastfeeding. Tinatawag din ang STD na sexually transmitted infection or STI or venereal disease or VD. Delikado magkaroon nito dahil madali itong kumalat at mahirap tukuyin kung sino ang merong STD. Types of STDs. Chlamydia is a sexually transmissible infection. Wala itong sintomas at naapektuhan nito ang urethra, cervix, rectum, anus, throat, and eyes. Human papillomavirus is a virus that can be passed from one person to another through intimate skin-to-skin or sexual contact. Syphilis is another bacterial infection. It often goes unnoticed. It is early stages. The first symptom to appear is a small round sore known as a chancre. It can develop on your genitals, anus, or mouth. It's painless but very infectious. HIV can damage the immune system and raise the risk of contracting other viruses or bacteria and certain cancers. If left undertreated, it can lead to stage 3 HIV, known as AIDS. But with today's treatment, many people living with HIV don't ever develop AIDS. Gonorrhea is another common bacteria STD. It's also known as the CLAP. Many people with gonorrhea develop no symptoms. Pubic lice or crabs is another name for pubic lice. They're tiny insects that can take up residence on your pubic hair, like head lice or body lice. They feed on human blood. Trichomoniasis is also known as stretch. It's caused by a tiny protozoan organism that can be passed from one person to another through genital contact. And herpes. Herpes is the shortened name for herpes simplex virus or HSV. There are two main strains of the virus, HSV1 and HSV2. Both can be transmitted sexually. It's a very common STD. The CDC estimates more than 1 out of 6 people ages of 14 to 49 have herpes in United States. Many STD are curable, like chlamydia, syphilis, gonorrhea, crabs, and trichomoniasis, and others can be cured, like HPV, HIV, and herpes. Treatment of STDs. The recommended treatment for STDs varies depending on what STD you have. It's very important that you and your sexual partner be successfully treated for STDs before resuming sexual activity. Otherwise, you can pass an infection back and forth between you. Siyempre, kailangan mo muna siguraduhin na treated na yung STD mo para hindi na rin makahawa sa partner mo. STD prevention. Avoiding sexual contact is the only foolproof way to avoid STDs. But if you do have vaginal, anal, or oral sex, there are ways to make it safer. Like paggamit ng condoms. Condoms are generally effective at preventing STDs. Living with STDs. If you test positive for an STDs, it's important to get treatment as soon as possible. Mahalagang matreatment agad ito para hindi na mas lumala pa at hindi na o maiwasan na makahawa pa sa iba.
For the next presenter, let me call on Miss Merenida Chavez.
Hello guys, ang i-discuss ko naman sa inyo ay about sa family planning or method of contraception. Ano nga ba ang family planning? It is educational, comprehensive, medical, or social activities. Mostly po yung mga barangay or government ang nagbibigay ng mga ganitong programa, lalo na sa mga mahihirap kasi mostly po sila po yung mga wala talagang kaalaman tungkol sa family planning. Bakit nga ba nila ito ginagawa? Para bigyan ng knowledge ang mag-asawa or gives enough time and opportunity to love and provide attention to her husband and children. Family planning is having the number of children based on the couple's belief, health, and economic
situation. Ibe-base ng isang couple kung ilan ang gusto nilang anak sa paniniwala nila. Like, isa lang or dalawa para maibibigay nila lahat ng needs ng anak nila. Tapos, syempre, need din i-consider yung health nilang mag-asawa, lalo na nung babae kasi siya yung manganganak. And then, economic situation. Kailangan din siya i-consider kasi kailangan natin malaman kung yung economic condition ba ay okay. Number 2 is spacing births properly. Kailangan din na pagpahingahin muna yung babae pagkatapos manganak and dapat pinag-uusapan ng mag-asawa kung ilang years ang age gap na gusto nila sa magiging anak nila. Kunwari, yung panganay nila bago nila sundan ay after 5 years or after 6 years, ganon. Next is making sure pregnancies occur only during the right time in a mother's life. Ayan. Siyempre, kailangan dapat pag mag-aanak ang isang babae, dapat sa tingin niya ay or feeling niya right time na. Kasi mahirap naman pag nabuntis agad, lalo na kung hindi pa ready ang isang babae kasi maraming possible na mangyari pag nabuntis ng maaga. And mahirap magbuntis ng maaga lalo na kung wala kang kaalam-alam sa mga dapat bang gawin. And then next is helping childless couples have children. Yun dito naman kasi may mga couple na hindi sila capable talaga na magkaanak. Tapos may mga tao na natulong sa kanila para magka-baby. Yun ang tinatawag na surrogate pregnancy, baby maker kung tawagin, or pwede ding sperm donor. Purpose of family planning. To avoid unwanted births. Para maiwasan ang unwanted births or sa madaling salita ay unexpected or teenage pregnancy. Kasi ayun nga, alam naman natin na sa panahon ngayon ay marami ng kabataan na nabubuntis. And to bring about wanted births. Yung sa dito naman ay to bring about wanted births. Dito naman, yung women or yung mag-asawa ay typically na wine-welcome yung pagbubuntis at yung baby. Kasi, lalo na kung plano talaga na magkaroon na ng anak. Next is to regulate the interval between pregnancy. So, yung dito naman, kailangan ma-regulate yung pagitan ng pag-anak para hindi taon-taon ay buntis para makaiwas din na dumami ang anak with only a year of interval sa isa't isa. To determine the numbers of children in the family. Dito naman para malaman kung ilang children ang fit para sa isang pamilya and kung ilang anak ba ang kaya nilang buhayin or kaya nilang mabigyan ng mga pangangailangan. Kasi mahirap pag madami yung anak tapos hindi maibibigay lahat ng needs ng mga bata. Next is advantage of family planning. Reducing adolescent pregnancy. Reducing adolescent pregnancy. Dito naman para mabawasan yung mga teenage pregnancy or yung mga adolescent na babae na 19 pataas na nabubuntis. And then slowing population growth, economic advantage, better life. So pag alam na ng isang mag-asawa ang family planning, papasok dito yung uunti na yung
population growth ng isang bansa. Economic advantage. If yung mag-asawa ay may kaalaman na sa family planning, nagiging advantage to kasi nagkakaroon sila ng more opportunities to pursue and mas uunahin nilang i-pursue muna yung career nila and makapag-ipon para pag nagkaanak sila, masusuportahan nila ito ng ayos kasi financially stable na sila. At pag nagawa naman nila yon, magkakaroon na sila ng better life. Kasi mahirap naman pag wala kang kaalaman sa family planning kasi karamihan ay madaming nagiging anak and yung iba hindi na talaga nabibigay yung needs ng mga anak nila. And yung iba hindi na napapag-aral and pinagtatrabaho na lang nila kasi mahirap nga yung buhay at kailangan na nilang tumulong. Tumulong kasi example, may yung panganay sa isang pamilya tapos marami siyang kapatid and parang mas gugustuhin niya na tumulong na lang sa magulang niya para may makain sila ng mga kapatid niya. Kaya mahalaga talaga na may kaalaman sa family planning and preventing pregnancy-related health risks in women. Preventing pregnancy-related health risks in women, including early pregnancies and unsafe abortion. So, advantage siya sa family planning kasi if alam na nila yung family planning, mababawasan or mape-prevent yung mga health ng mga babae na buntis and mababawasan din yung mga early pregnancy kasi alam na nila yung mga dapat gawin kasi alam nila yung family planning. And mababawasan din yung mga abortion kasi alam naman natin na may mga tao talaga na nagpapa-abort kasi alam naman natin na may mga tao pang nagpapa-abort kasi maaga silang nabuntis or hindi nila gusto na nabuntis sila. Next is reducing infant mortality due to closely spaced pregnancy and early pregnancy. Ayun, mababawasan ang mga baby na namamatay dahil napaaga ng anak or kulang sa alaga since hindi nga educated ang parents. Pero kung alam naman na ng parents kung yung mga dapat gawin and yung about sa family planning, mababawasan na yung mga gantong scenario. There are negative effects of family planning, lalo na sa mga nagpipills or injection. Ayun ay irregular bleeding, no period, headache, pagduduwal, dizziness, weight gain, or weight loss. So, may iba't ibang birth control methods. May iba't ibang birth control methods. May condom, female condom, pill, hormonal ring, UID, injection, surgical sterilization, implant, coitus interruptus, calendar rhythm method, patch, diaphragm. Ang mostly na ginagamit dito ay yung condom, pill, injection, and calendar rhythm method. Yung sa pill and injection, kailangan mo nang magpa-consult ng babae sa OB-GYN na doktor Kasi mahirap pag magte-take ka or magpapa-inject ka ng hindi ka man lang kumo-consult sa doktor kasi may mga side effect din ito. Lalo na sa injection, ang side effect nito ay hindi nagkakaroon ng monthly period ang babae, which is masama kasi kailangan ay every month ay nagre-release ng dugo ang isang babae. And may ipapanood kaming video about sa family planning. Isa to sa magandang halimbawa ng family planning. Napanood natin sa video na hindi alam ng magulang ng mga bata ang family planning kaya ang kinalabasan ay marami silang naging anak. Malaki ang epekto ng family planning sa isang pamilya kasi kung wala kang kaalaman dito ay maaaring matulad kayo sa nasa video. Imbis na pinag-aaral ang kanilang anak, nagtatrabaho sila kasi marami silang magkakapatid at hindi sila kayang buhayin ng kanilang magulang. Hindi kayang ibigay ang mga pangangailangan nila. Kaya sobrang halaga ng may kaalaman sa family planning kasi kaya sobrang halaga na may kaalaman sa family planning para maiwasan yung mga ganitong pangyayari na maraming anak tapos hindi na ibibigay yung mga pangangailangan ng anak nila na imbis na pinag-aaral dapat yung mga bata, ang ginagawa na lang namamalimos or nagtatrabaho kasi hindi kaya ng magulang na pag-aralin sila. Kaya mahalaga talaga na magkaroon ng kaalamanan tungkol sa family planning. Ayun lang po, thank you.
Thank you for your time. If you have any questions regarding our topic, please do not ashamed to ask any questions. We will answer it to the best of our knowledge. Thank you so much.
Thank you.